Hello, my name is Kevin Woodson. I'm a medical doctor at Prelude AI. Prelude AI is a platform that allows you to create and use AI assistants that can interact with patients by taking a clinical history using either voice or text and then writing medical documentation. They're highly customizable to different workflows, clinical scenarios, settings, and medical documentation formats. So, in order to show you what I mean by that, I will just show you an example. Here we have a few different options. There's urgent care, first visit, and follow up. These are different AI assistants for different, I guess, workflows you could call them. We'll just show the general urgent care one. So we each agent gets its own custom link. So the website is highprelude.com, and so the custom link, branded link is for this one is highprelude.com/QB under urgent care. So you just copy it and you can share this with the patients. So in order to use the AI assistant, the patients don't need to download an app. They don't need to register an account. You just give them the link and they come here and they just type in their contact information and they can start. So I'll just make something up. And you can do either voice or text. So to start, I'll just show you voice and then I'll show you text after that.
Hello and welcome. I am an AI medical assistant for QB Health. The goal of this conversation is to collect some information for a healthcare provider to review. Are you ready to proceed?
Yeah.
Great. Can you please tell me your age and gender?
Yeah, I'm a 34-year-old man.
Thank you. What medical issue would you like to address today?
Headache.
I'm sorry to hear that you're experiencing headaches. When did the headache start?
Yesterday.
Can you tell me where exactly on your head you feel the pain?
Yeah, it's on the left side of my head.
Got it. How would you describe the pain? Is it throbbing, constant, sharp, or something else?
Pulsating.
Thank you. How severe is the pain on a scale from 1 to 10, where 10 is the worst pain imaginable?
It gets up to a 7, but usually it's more like a 4.
Thanks for telling me. How long does each headache episode last?
About 3 hours.
All right. Are there any things you do that seem to make the headache worse?
Um, Bright lights kind of irritate it.
Thank you. Is there anything that makes the headache feel better?
Napping helps. Also, I used to take a medication. It was called sumatriptan a few years ago that a doctor prescribed. It helped a lot, but I don't have it anymore.
Got it. Have you tried any treatments or medications since the headache started yesterday? If so, did
Uh,
they help?
I took ibuprofen.
Did the ibuprofen help relieve the pain?
Yeah.
Good to know. Have you had headaches like this before, or is this the first time?
It's been a chronic, ongoing thing for like 10 years.
Understood. You have a history of any other medical conditions?
Yeah, I have high blood pressure.
Thanks for sharing. Are you currently taking any medications for your high blood pressure? If so, which ones?
Yeah, I take lisinopril.
Just to confirm, did you mean lisinopril? And if
Yeah,
so, do you know the dosage and how often you take it?
I take 40 milligrams once a day of lisinopril. Yes.
Thank you for confirming. Do you have any allergies to medications or anything else? If so, can you describe the reactions?
Yeah, I'm allergic to penicillin. I had a rash on my skin when I was a little kid when I took it, but I don't really remember.
Thank you for the details. Are you currently experiencing any other symptoms along with the headache, such as nausea, vision changes, or dizziness?
No.
Thanks for letting me know. Have you experienced any recent changes in your lifestyle, such as changes in your sleep patterns, stress levels, or diet, that might be affecting your headaches?
No.
Thank you for providing the needed information. Your responses will be made available for your care team to review. You may end the conversation now. Have a great day.
Thanks.
You're welcome.
So that's what it looks like if you use the voice assistant. You can also use the text chat assistant, as you can see on the screen now. I just recorded this on my phone. Most people nowadays are familiar with chatting by text, and this is just an example of that. It looks good on the phone. It's designed to be used on the phone. It can be used on the desktop as well. And this is what it looks like on the desktop. Just looks like your standard chat interface. So yeah, there's a lot of options. They can do voice, interact with the voice assistant on the phone, voice assistant on their laptop, text on the phone, or text on their laptop. And you can even call it on the phone just by even like a landline. We can give you a phone number, and it can be dialed, and they can just speak directly to it over the phone. Not even a mobile phone, just a regular landline can work. So, whether they interact with the AI assistant using voice or text, you can see the information about the visits here on this page. So your visits will be divided up by which assistant the patient talked to. So we can look at the one that we just talked to. So you basically get an audio recording that you can listen to if you want. There's a transcript, and then there's the actual AI generated documentation.
Hello and welcome. I am an AI.
Helps. Also, I used to take a medication. It was called sumatriptan. Yeah, I take like so you can listen to that if you want. There's also the transcript. So it just has, the text of the conversation that we, in case you want to read that. And then, last but not least, is the AI generated note. So I instructed it to write it in the format of a history and physical. So, see if you complain headache. Patient is 34-year-old with past medical history of high blood pressure, presents with headache. It pretty much just writes the the history, as we previously talked about. The whole note, assessment and plan, migraine headache, likely experiencing migraines. Recommend restarting sumatriptan, etc. And yeah, so you could just copy and paste this into your EMR if you want. You can also edit it here if you want, like scores like present. Yeah, so that's pretty much it. Thanks for watching.